Hello, and thank you for joining us for TGH Ask an Expert, a live Q&A series. I am your moderator, Karen Loftus, and I am joined by Dr. Henry Rodriguez, Professor of Pediatrics at the University of South Florida, College of Medicine, and Clinical Director of the USF Diabetes and Endocrinology Center, and Pratiksha Thapa, Assistant Professor of Medicine and the Director of Adult Diabetes at the USF Diabetes and Endocrinology Center. Thank you so much, both of you, for being here today.
Thanks for having us.
All right, so we are here today for a special occasion. Today is World Diabetes Day, and this is during National Diabetes Awareness Month. And this is a time dedicated to raising awareness and supporting those affected by diabetes. Before we get into our discussion, we do have a few housekeeping notes, as we always do. If you have any questions as you're watching live, as we go along, place them in the comments section, and that's for YouTube if you're watching on that platform, or on Facebook. We'll get to as many of those as possible, and then plus we have several pre-submitted questions. So we're going to get to as many of those as possible as time allows. And one reminder for you all, yes, Dr. Rodriguez and Dr. Thapa are medical professionals, but please always consult your primary care provider for individualized medical advice. Okay, y'all ready? As I mentioned, it is National Diabetes Month. Dr. Rodriguez, why is this topic so important?
So World Diabetes Day is celebrated on November the 14th to honor the birthday of Dr. Frederick Banting, who along with Dr. Charles Best co-discovered insulin in 1922. And the International Diabetes Federation and the World Health Organization established the day in 1991. The United Nations adopted the day by proclamation in 2006. And as you mentioned earlier, it really is to promote awareness of diabetes, prevention, diagnosis, and treatment of the disease. And the reason that this is so important is if you look nationally, over 38 million Americans, or nearly 12% of the population, have diabetes, and the vast majority has type 2. Of those, over 350,000 are less than 20 years of age, and the majority of those that I see as a pediatric endocrinologist have type 1. And it's important to note that of all those with diabetes, nearly 9 million have evidence of high blood sugars, but no symptoms. And so the American Diabetes Association has a short questionnaire. It's called the Type 2 Diabetes Risk Test. And individuals are encouraged to go to their website, complete that. And if they score above a certain level, then they're encouraged to talk to their health provider to determine whether they indeed have high risk for diabetes, maybe have type 1, type 2, perhaps. 1.2 million Americans are diagnosed with diabetes each year. And in the state of Florida, we're talking about 2.3 million, or nearly 10% of the population, with nearly 140,000 diagnosed every year. So this is a topic of obviously great importance.
All right, let's get into some of our pre-submitted questions. Thank you so much for setting the table for this discussion. All right, our first pre-submitted question. How can you manage blood sugar and blood pressure spikes even when you are doing everything right, Dr. Rodriguez?
Yeah, I mean, I honestly, the recommendation is to work with your healthcare team, your diabetes healthcare team. That includes your provider, your dietitian or diabetes educator. You may have a diabetes technology specialist. I really find increasingly with the technology, we're able to look at, a few hours, 24 hours of blood glucose measurements on a smartphone. Platforms allow you to look at a larger period of time. I refer to it as looking at it on the big screen. So look at 1 or 2 weeks of data rather than just looking at the last 24 hours. Sometimes that brings things into focus, and pattern recognition could be very, very, very helpful in working with your healthcare team.
All right, thank you so much. All right, our next pre-submitted question. Are supplements effective and safe options for managing diabetes, Dr. Thapa?
So this is a very common scenario we see every day, every other week in my clinic. I have a handful of patients who are diabetic and they come up with their list of the supplement, or sometimes they even bring their supplement. So if you go by the guidelines, American Diabetes Association and ACE, American Association of Clinical Endocrinology, they have both clearly stated that unless there is an underlying deficiency, there is no proven benefit from the routine use of the supplements. And the main concern about is the relatable concern to not to use this supplement is because they are not regulated as the prescribed medication. So having said that, I do have a lot of handful of patients who would say that, okay, after being on so and so antioxidant and probiotic, my diabetes has been a little bit better. There has been some modest benefit, but there is no lot of evidence. So I would say, like, solely for glycemic control, we do not recommend going any supplements other than the prescription medication.
Okay, thank you. All right, our next pre-submitted question. I feel like this is one that a lot of people are going to want to know about. What are the best strategies for eating out while managing diabetes, and especially with children, Dr. Rodriguez?
So, as is true for most diabetes management tasks, it pays to plan ahead. Try to review, if possible, menus ahead of time, not only to determine carbohydrate amounts, but also to determine, particularly for children, what they're likely to be, what's likely to be appealing to them. So, planning that ahead, there are smartphone applications, websites that you can search, and they provide valuable information as well. Our goal really is to administer mealtime insulin prior to eating. So having a dish that your child is more likely to eat, certainly helpful. Having bread or another source of carbohydrate on hand at the table in case your order is delayed, because again, we're focusing on ideally administering that insulin before you eat. And then, certainly if there's a particular dessert that calls your attention after the fact, you can certainly give additional insulin to cover that additional carbohydrate. So really, it's planning ahead and having your wits about you.
That makes sense. A lot of good tips there. And I do want to remind everybody watching live. Well, first of all, just thank you all for tuning in to this wonderful discussion today. And also, we're taking live questions and live comments in the chat. So whether you're watching on YouTube or Facebook, feel free to drop in a question, and hopefully we have time to get to some of those. We're going to get to another pre-submitted question here now. This person said, I've been managing my type 2 diabetes well. They're on medication, and they also have hypothyroidism. And on top of that, they're really struggling to lose weight. Why might that be? And what can this person do to support weight loss more effectively? Dr. Rodriguez. Or this one's for Dr. Thapa, actually.
Okay, so this is a great question, actually. It's very, very common. Despite of doing everything right, a lot of our patients, especially a diabetic patient, would suffer, like not being able to lose their weight. The cause could be a lot of things. Like, one could be just the physiological adaptation. So once somebody has diabetes, we recommend all of our patients to have a frequent meal, short meals, so small portion but frequent meals that would increase their appetite. And on top of it, they have hypothyroidism. There's something called basal metabolic rate, BMR. Like, our whole body is like a machine, so even if we don't do anything, it needs certain amount of energy to get us going. So for hypothyroid patient, it's already, the BMR is already like low. So it will be a little bit tough for them to lose weight. And again, if someone with an improved blood sugar level, what happens is the glycosuria would be less. They won't be losing a lot of sugar from their urine, so there won't be a lot of calorie loss through that route as well. Another reason could be because they have been on, because of the medication itself, there are a lot of medicine, insulin, sulfonylurea, they tend to gain weight as well. And of course, there are a few weight neutral medication, but with that also, they would sometimes counteract with the weight loss. Very, very important thing is the behavioral and environment factor, because having in the privilege side, here in United States, we have a lot of opportunities, a lot of availability in terms of food, and also very high calorie and high carb diet. That could be the thing. And another thing, we have a sedentary lifestyle over there. And the one of the important thing we cannot ignore is where we come from, the genetic factor itself. So some patients have that resistance with the weight loss because of the genes as well. So what to be done, it could be a very long topic of discussion, but briefly, we should always focus on the lifestyle and behavioral intervention. There could be they can always go through a structural behavioral program. Of course, it would be led by a trained person, diabetic educator, and they can get a lot of dietary counseling. They can do the plant-based diet with like low carb. They can always go for a Mediterranean diet, which is considered really good. And there's a very good trial, like look ahead trial, if our patient could look into it. It recommends like to lose weight. We recommend all of our diabetic patients to at least do 150 minutes of exercise in a week. And if they could try to be on the calorie deficit, like less than 500 of the calorie deficit a day, a lot of factor, and all of the, if it doesn't work out, then of course there is a medication help, GLP, GIP inhibitor, Ozempic, Monjaro, all of those.
Wonderful. So much great information there. We have a nice comment in the chats here. Somebody just thanking you both for your time and your information talking about this topic today. So, okay, so we have another question to get to. And, there's so much research done on this topic and, we've come a long way. What sort of progress have you seen in clinical care in diabetes in the last 5 to 10 years? Dr. Thapa.
So this is another like very good question. So looking back, like not just the 10 year, even with the 5 years, there is so many things coming up with diabetes, a lot of opportunity everywhere we turn around. I would say the first and foremost thing I have seen personally, like witness, is the structural evidence-based lifestyle and behavioral program. There have been so many advances in that scenario. They would help our patient for cognitive behavioral therapy. They would just do a separate section for the craving management. That's a really good side. Another is I could see that there has been a lot of expanded dietary options. So let's say compare with last few years to until now, even if we go out on the restaurant, the food choices are so much tailored to the individual need. Like we'll get sugar free, calorie consistent, like all the information are written there. I would say that's that people are being more and more I would say knowledgeable about that part. And talking about our side in terms of medicine, medical ways itself, like lots of change, lots of enhancement in the medical progress. Many of the medicine has been discovered, like GIP, GLP on agonist, Ozempic, Monjaro. And one of the good advances I would say is like a CGM, the sensor we use for the continuous glucose monitoring. We have a week, then 10 days, 15 days, and now we have already like launched a 365-day sensor for the whole year. And I can just touch base on the automated insulin delivery system, like insulin pump. When it was started, it was close to a size of a backpack, and now it's like 2 to 3 inches. It itself is an like amazing changes. And another very important thing I could notice is like people has been more aware, and they are looking for more possibility to, despite of this medication, if they could not achieve like proper control, they do not hesitate to go for surgical options as well, metabolic surgery, bariatric surgery. There has been lots of progress in that regard as well.
That's wonderful. I mean, so much work is being done. And I definitely want to get to more of like the future of things. I want to go back to a question about lifestyle management, though. We had a question about interventions. What are some interventions to curb or eradicate severe refined sugar cravings, Dr. Rodriguez?
Yeah, that's a challenge. Certainly, refined sugars have a dramatic effect on blood sugar. So, simply any liquid beverage that has sugar in it is going to boost that blood sugar up very quickly. And so much so that that's what we use if individuals have low blood sugars. We want to correct that rapidly. But, certainly judicious use of artificial sweeteners, we recommend in small amounts, right? Judiciously. There are dangers if you lab animals that consume tremendous amounts, which we don't use. And then really accustoming one's taste buds to less sweet over time. But yeah, this certainly is a challenge. I want to emphasize that, there are no forbidden foods for individuals with diabetes. It's really trying to match their insulin doses, their medication doses, their activity to allow them to maintain, ideal blood glucose control.
Absolutely. I absolutely agree with whatever Dr. Rodriguez says. Yes, only the best way would be if they could use the non-nutritive sweeteners. And at the same time, for the specific craving, they do have a cognitive behavioral therapy where patient can go and do the dietary modification. And if not, again, the same GLP and GIP agonists, they will be able to curb their appetite as well.
Yeah, some really good points there. I want to remind everybody who's watching, please feel free to drop any questions or comments in the chat. These two are experts on this subject, and they would love to answer any questions that you all have on this subject. We did have another comment about somebody who's on a CGM, and they've had really good results with that, and just been able to be held accountable, and just that, again, CGM, continuous glucose monitoring, which is, where we were talking about the technology. Yes. So let's get back to the topic of technology and where we see this going, because there's so much more to learn, right? What can we anticipate in the future based on current research, Dr. Rodriguez?
Yeah, so I think if you look at day-to-day management, as Dr. Thapa mentioned, the use of continuous glucose monitors now paired with insulin pumps have allowed the development of what we refer to as automated insulin delivery systems, or AID. So that is decreasing the burden of managing particularly those individuals that have type 1 diabetes. And that's an area, both clinically and from a clinical research standpoint, that I focused on for much of my career. I think if you look at, again, specifically the area of type 1 diabetes, we've been very fortunate to receive funding from the National Institutes of Health and with industry partners to really look at therapies that can prevent the development of type 1 diabetes. The first therapy that's been shown to delay the requirement of insulin therapy for individuals with type 1 diabetes was approved 3 years ago this month. And so there are an expanding number of therapies. I think of it from the perspective of, we are now in type 1 diabetes, I think, where those individuals that were very active in research in cancer therapy years ago, when individuals have the misfortune of being diagnosed with cancer, they're not just treated with one drug, they're treated with multiple drugs. And so we've identified in the research community a number of therapies that appear to have promising effects in terms of maintaining the body's ability to continue to produce insulin. And we're looking in the future to really looking at combinations of those therapies. So we're identifying individuals at risk and really investigating these therapies that one day hopefully will allow us to further delay and ultimately prevent diabetes, and certainly improve day-to-day management. I should say, with these technologies, managing diabetes is still challenging. There's no doubt, but the technologies are making the less of a burden.
Okay, we did have a question in here. This was about the sugar and artificial sweeteners. Somebody asked, I haven't heard of this, what are your thoughts on liquid stevia? Is that okay? Whichever one of you wants to take that one.
Yeah, it's okay. Yes, it is. A lot of our patients, they consume it on daily basis. And again, like, too much of everything is not good, but if it could be done, maybe like, let's say in your morning coffees and a little bit of here and there, maybe 2 to 3 serving, it should be fine. It's safe.
And I would add that, is this true for most things? Whether you're utilizing blood glucose monitoring or continuous glucose monitors, it really allows you to look at what the effect of a sweetener, unless you start using something new, to look at what effect that has on your blood sugar control, and then adjust accordingly.
That's a great point as well. Yes.
Good point. All right. I think we've reached the end of our pre-submitted questions, and I'll give one last plug to see if anybody wants to add any comments or questions. But thank you both, Dr. Thapa, Dr. Rodriguez. This has been such a wonderful discussion that was aligned with World Diabetes Day. So thank you both so much for your time.
You're so welcome. Happy World Diabetes Day.
Happy World Diabetes Day. Thank you for having us.
All right, absolutely. All right, so if you want to know more about this topic and for more information, thank you guys so much for joining us, and everybody else who has shared their questions for this discussion. So if you want to know more about diabetes and our Endocrinology Institute resources at Tampa General Hospital or USF Health and USF Health, please visit the web address on your screen, use the QR code, or use the contact information that is also on your screen. Thank you to all that joined live and those who have tuned in afterwards on demand. We look forward to seeing you on the next Ask an Expert, a live Q&A series presented by Tampa General Hospital and USF Health. Have a great day.